I've spent over 17 years as a physician. I've held the hands of patients who were terrified. I've watched families collapse in hospital hallways. I've seen recoveries that felt like miracles and losses that never fully leave you. And after all of that, after thousands of patients, thousands of cases, thousands of decisions, the most important lesson medicine ever taught me is one that almost no doctor will say out loud. Sometimes the wisest medical decision you will ever make is doing nothing at all. I know that sounds insane coming from a doctor, and I know it goes against everything you've been told your whole life. Get checked, catch it early, be proactive. More information is always better. We've been sold that idea for decades, and most people have never once questioned it. Today, I'm questioning it for you. Because after everything I've seen, 3 decades of evidence, real patients, real consequences, I'm going to share with you 5 routine medical checkups that I personally would never get after the age of 70. Not because I'm reckless, not because I don't believe in medicine, but because the science and the stories I've witnessed tell a completely different story than what most doctors are selling. These are tests that get marketed as cutting-edge prevention, as peace of mind, as the responsible thing to do. But what they actually do, especially in older adults, is drag people into a spiral of anxiety, unnecessary procedures, and life-altering complications that steal the very thing that matters most in your later years: your independence, your joy, your quality of life. So, if you are over 70, if your parents are over 70, if your grandparents are heading there, stay with me. Because this might be the most important medical conversation you've never had. Let's start with the one that sounds the most impressive: the full body scan. You've seen the ads. Private clinics, executive health packages, premium wellness centers. They promise you a head-to-toe tour of your insides using the latest MRI or CT technology. A complete picture, total peace of mind. The ultimate in prevention. Catch anything before it ever becomes a problem. It sounds incredible, doesn't it? Who wouldn't want that? I want you to meet someone. I'll call him Robert. He was 74 years old, healthy, active, played golf twice a week, traveled with his wife, adored his grandchildren. Not a single symptom, not a single complaint. His son, with nothing but love in his heart, bought him a full-body executive scan as a birthday gift. Robert went mostly to make his son happy, and that one decision unraveled the next 6 months of his life. The scan came back with a note that stopped his heart cold. A small, indeterminate lesion, 1.5 centimeters, on the left kidney, indeterminate lesion. 2 words that detonated like a bomb inside a perfectly healthy man's world. Overnight, Robert went from a vibrant grandfather to a man with a lesion on his kidney. His doctor, following protocol, sent him to a urologist. The urologist, wanting to be thorough, recommended a biopsy. A kidney biopsy is not a minor thing. It involves inserting a long needle through your back and into your kidney. There are real risks: bleeding, infection, significant pain. Robert agreed because what else do you do when someone tells you something might be growing inside you? He waited a week for the results. A week where he could barely sleep, where his wife cried quietly when she thought he wasn't looking, where his son blamed himself every single day. And the final verdict? A benign tumor, completely harmless, made of fat and muscle and blood vessels. Something that had likely been sitting there quietly for decades and would have continued doing absolutely nothing for the rest of Robert's life. He gained nothing. He lost everything that week: his peace, his confidence, his sense of being healthy. He went through an invasive procedure he never needed. His family suffered trauma they never needed to carry. And here is the number that should make every single person watching this sit up straight. Studies show that in healthy older adults who undergo full-body scans, up to 86% will have something found on that scan. Something. And the overwhelming majority of those somethings are what we call incidentalomas. Accidental findings. Benign, harmless, irrelevant. A spot on the liver, a cyst on a kidney, a nodule in the lung, the body's version of scars from a life fully lived. They've been there for years. They will never cause a single problem. But once you find them, you cannot unknow them. And that triggers what we call the cascade of intervention. The finding creates anxiety. The anxiety demands more tests. The tests carry their own risks. And before you know it, a person who walked in completely healthy is being wheeled into a procedure room for something that was never going to hurt them. And if the scan used is a CT, a computed tomography scan, you're also absorbing a meaningful dose of radiation, the equivalent of hundreds of chest X-rays in a single session. Radiation accumulates in the body. The risk of any one scan is low, but it is not zero. And when there is no clear benefit on the other side of that risk, why take it at all? So, what do you do instead? You forget the machine and you choose something far more powerful. A comprehensive geriatric evaluation, not a simple checkup. A real, unhurried conversation with a physician who understands how the body actually ages. Instead of hunting for shadows, you focus on what genuinely determines quality of life, function. In this kind of evaluation, we measure frailty, not as an insult, as a clinical concept. We look at things like walking speed and grip strength. Those two simple markers predict future health outcomes better than almost any imaging technology on Earth. If early frailty is detected, you can reverse it with targeted exercise and nutrition before it ever becomes a crisis. We also do a deep review of medications. It is astonishing how many older adults are taking 10, 12, sometimes 15 different pills prescribed by different specialists who may not even know what the others have prescribed. Symptoms like dizziness, confusion, memory issues, they're often not a new disease. They're side effects of a medication. Cleaning up that list can transform someone's quality of life in weeks. And then we look at the true pillars of prevention: diet, sleep, physical activity, social connection. These are not sexy, they don't make for flashy advertisements, but they prevent more disease than any scanner ever will. A comprehensive geriatric evaluation does not create anxiety, it creates power. It doesn't search for theoretical problems. It optimizes the life you are actually living right now. The next checkup on my list is the routine brain MRI for mild forgetfulness. I see this constantly. A patient in their mid-70s or early 80s comes in, often brought by their children, because they occasionally forget the name of an actor or walked upstairs and forgot why. Normal aging, classic, textbook normal aging. But the fear of Alzheimer's is so enormous, so paralyzing, that the family demands a brain scan to see what's happening in there. I need you to hear this clearly. Ordering a brain MRI for mild, typical age-related forgetfulness is almost always a terrible idea. You are not opening a window into someone's health. You are opening Pandora's box. I'll tell you about a woman I'll call Martha, 78 years old, sharp, well-read, passionately intellectual. She started to notice that sometimes she'd struggle to find exactly the right word mid-sentence. Her daughter, genuinely frightened, pushed her toward a brain MRI. And when the results came back, Martha's world collapsed. The radiologist's report described mild diffuse cortical atrophy and scattered white matter changes. To any physician, that report is a completely routine description of a normal 78-year-old brain. It's the neurological equivalent of saying someone her age has wrinkles. Mild atrophy is a slight, expected reduction in brain volume that happens with time. White matter changes are tiny marks, like faint scars, that often result from blood pressure being slightly elevated over many years. Expected, normal, unremarkable. But to Martha and her daughter, those words, brain atrophy, lesions, sounded like a death sentence. They left that appointment convinced that Alzheimer's was already beginning. And from that day forward, Martha was a different person. She started doubting herself constantly. She quit her book club because she was afraid of forgetting a character's name. She stopped engaging with the things that had always brought her joy. The MRI didn't give her a diagnosis. It stole her confidence in her own mind. And now the statistic that should stop you in your tracks. In studies conducted on completely healthy adults, over 94% of brain MRIs come back with findings that could be labeled abnormal. 94%. If you scan 100 healthy people that age, 94 of them will leave with a report containing language that can induce pure panic. The devastating irony? Those images correlate very poorly with actual brain function. I have seen patients with brain MRIs that looked alarming on paper and a mind that was razor sharp in conversation. And I've seen the reverse. The image is not the person. The image is not even close to the full story. And here's the part that makes this truly inexcusable. The MRI result does not change the treatment for mild forgetfulness. There is no medication that reverses normal age-related brain changes. The scan costs money, generates radiation-free worry, and in most cases changes absolutely nothing about how you'd be treated. So, what do you do instead? You start with a 10-minute cognitive screening test, simple tools that ask a patient to remember 3 words, draw a clock face, answer a few orientation questions. Fast, non-invasive, and genuinely informative about how the brain is actually functioning, not just how it looks on a screen. If that test is normal, you can reassure the family with real confidence. If it shows something worth watching, then instead of jumping to an MRI, you investigate the most common and most treatable causes of memory changes first. Medications. Always the first suspect. Sleep aids, anxiety medications, certain antihistamines can all cloud the mind. Vitamin B12 deficiency, extremely common in older adults and very easily corrected. Thyroid function. An underactive thyroid can cause brain fog that perfectly mimics early cognitive decline. Depression. In older adults, depression frequently shows up not as sadness, but as apathy and memory problems. And sleep apnea, a condition where the brain is quietly being starved of oxygen every single night, and one of the most underdiagnosed causes of cognitive decline in this age group. Only after all of that has been explored, if functional tests still show a progressive decline, does imaging become a meaningful part of the picture. The message is simple. For mild forgetfulness, don't run to the scanner. Run to a doctor who will sit with you, evaluate your real-world function, and search first for what can actually be fixed. Now let's talk about the third test. The routine cardiac stress test. I'm talking specifically about putting someone over 70 who feels perfectly well, no chest pain, no breathlessness, no symptoms whatsoever, onto a treadmill and pushing their heart because it's protocol, because a certain age has been reached, because the system says so. This practice is far more dangerous than most people realize. Consider a patient I'll call James, 72 years old. He played tennis regularly, he walked every morning, 0 cardiac symptoms. He was going in for routine hernia surgery, and the hospital's protocol required a stress test for all patients over 70 before any procedure. James couldn't understand it. He just played 2 hours of competitive tennis. But protocol is protocol. Halfway through the stress test, James felt pressure in his chest. The electrocardiogram showed what the cardiologist called equivocal changes, uncertain results. And when you have an uncertain positive result on a cardiac stress test, the standard next step is a cardiac catheterization, a procedure where a tube is threaded through an artery all the way to the heart to visualize the coronary arteries directly. James walked in for a pre-surgical routine test. He was now on a gurney heading toward a cardiac procedure. The result? His arteries had the kind of mild buildup completely normal for a man his age, 30 to 40% narrowing that required nothing. No stent, no intervention, nothing. James had experienced a false positive, and the stress test in older adults has an alarmingly high false positive rate. It can return an abnormal result for dozens of reasons that have nothing to do with dangerous blockage. But the cascade had already started. James left that experience labeled a cardiac patient. He was prescribed a handful of new medications, and worst of all, he was afraid of exertion. He quit tennis. The test that was meant to protect him stole the physical activity that was actually keeping him alive. And we haven't even touched on the fact that the stress test itself, in rare cases, can trigger arrhythmias or cardiac events in people who may never have had an issue otherwise. What do you do instead? First, listen to your body. Seriously, the best stress test in the world is your daily life. If you can climb 2 flights of stairs or walk at a brisk pace without chest pain or dizziness, you are passing a stress test every single day without ever stepping on a treadmill. Learn the real warning signs that actually warrant evaluation. Chest discomfort during exertion, breathlessness wildly disproportionate to the activity, unexplained fainting or near fainting. Those symptoms matter, and those symptoms demand attention. But if you want a more precise look at cardiovascular risk with none of the dangers of a stress test, ask your doctor about a coronary calcium score. It's a brief, low-radiation CT scan. No needles, no exertion, takes about 5 minutes. It measures calcified plaque in the arterial walls. The result is a single number. A score of 0 means your near-term heart attack risk is extremely low. A high score means it's time to get serious about prevention. It tells you about risk. It guides prevention. It does not set off a chain of invasive procedures based on a number that might mean nothing. Don't let anyone run you on a treadmill by default. Trust your body, and if you want real data, ask for the calcium score. The fourth test is one that I want to handle carefully because it is genuinely valuable, just not forever. Routine colonoscopy after the age of 75 to 80 for someone with previously normal results and no special risk factors. Let me say this loudly and clearly first. Colonoscopy is one of the most powerful cancer prevention tools we have. For adults between 45 and 75, I recommend it without hesitation. Finding and removing precancerous polyps before they become dangerous, that's real medicine doing exactly what it should do. The problem is when we keep applying that same logic indefinitely, without ever adjusting for age and risk. There was a patient I'll call Elena, 79 years old. Her last colonoscopy at age 70 had been completely normal. Her electronic health record flagged that she was due for another. No symptoms, no family history of concern, but she was thorough. She followed medical advice, so she went. The preparation alone was brutal. Liters of a bowel-clearing solution that kept her in the bathroom through the night, leaving her dehydrated and physically depleted. At her age, that alone carries real risk. Then there's the sedation, which in older adults can cause confusion, respiratory issues, prolonged effects that younger patients simply don't experience. But the risk that genuinely keeps me up at night is perforation. As we age, the colon wall becomes thinner, more delicate. The risk of a small tear from the endoscope, though statistically uncommon, roughly 1 to 2 in 1,000, doubles or triples in adults over 75. And a perforation is not a minor complication. It is an emergency, major abdominal surgery, frequently a colostomy, an external bag. For an 80-year-old, an operation of that magnitude can be the end of independent living. Now weigh that against the benefit. Preventing a cancer that, if it appeared at all, would take 5 to 10 years to cause any real problem, potentially well beyond someone's realistic remaining life expectancy. The major medical guidelines have already concluded this. Routine colorectal cancer screening should generally stop somewhere between 75 and 85, depending on individual circumstances. The probability that the colonoscopy harms you becomes greater than the probability it saves you. Now, that does not mean you ignore your colon. You shift from invasive screening to intelligent surveillance. And the most important tool here is symptom awareness. A persistent change in bowel habits, blood in the stool, unexplained abdominal pain, unintentional weight loss, new anemia. If any of those appear, age does not matter. You investigate. Full stop. That is when colonoscopy is absolutely worth every risk it carries. And the most powerful long-term protection? Fiber. It sounds almost absurdly simple, but the science behind it is profound. Fruits, vegetables, legumes, whole grains, these feed the beneficial bacteria in your gut that produce compounds with genuine anti-inflammatory and anti-cancer properties. More lentils, more broccoli, more oats, more apples. Not glamorous, but safer, more effective, and beneficial to every system in your body simultaneously. Get your colonoscopies done on schedule through your mid-70s. After that, for most people, the conversation changes. Start listening to your body and start feeding it what it actually needs. And finally, the fifth test. This one is for the men, and it is arguably the most controversial item on this entire list. The routine PSA blood test for prostate cancer in men over 75. The PSA, prostate-specific antigen, was presented to the world as a breakthrough. A simple blood test that could catch prostate cancer early and save lives. And in some specific contexts, for some specific men, it still does exactly that. But in older men, especially those over 75, the routine use of PSA testing has quietly generated one of the greatest crises of overdiagnosis and overtreatment in the history of modern medicine. Let me tell you about a patient I'll call Charles, 80 years old, independent, active, fully engaged in his life. At a routine annual checkup, a PSA test was added to his blood work without any real discussion about whether he wanted it or what the implications might be. His result came back at 6.5, slightly above the reference range. Charles had no symptoms whatsoever, but that number triggered the cascade. Primary care to urologist, urologist to biopsy. A prostate biopsy is uncomfortable, carries real infection risk, and in Charles's case, that risk became his reality. He developed sepsis, a severe, life-threatening systemic infection. He was hospitalized. He recovered eventually, and then the biopsy result arrived. Prostate adenocarcinoma, Gleason score 6. Cancer. That word landed like a grenade. But what kind of cancer? A Gleason 6 prostate cancer is the most indolent, slow-moving form of the disease that exists. Many oncologists quietly debate whether it should even be classified as cancer in the traditional sense. For an 80-year-old man, the statistical reality is stark. The probability of dying from a Gleason 6 prostate cancer is virtually zero. He would almost certainly die with it, meaning it would simply exist harmlessly in his body while some entirely unrelated cause eventually ended his life. Autopsies consistently show that up to 80% of men in their 80s have microscopic foci of prostate cancer that never affected their health in any way, but Charles was told he had cancer, and when people hear cancer, they want it gone. Despite being offered active surveillance, careful monitoring without treatment, his anxiety won. He chose radiation therapy. The treatment was technically successful. The cancer was gone. But the price. Radiation caused permanent urinary incontinence. It caused permanent erectile dysfunction. His social world contracted. His sense of himself as a man was devastated. The treatment that was supposed to save him had destroyed the quality of the life it was supposedly saving. This is overdiagnosis, finding a cancer that would never have harmed him. And this is overtreatment, subjecting someone to aggressive, life-altering therapy for a disease that required none of it. And the PSA test is the engine driving that entire tragedy. The PSA level rises for countless reasons beyond cancer: inflammation, infection, a long bicycle ride the day before. And for every man whose life is genuinely saved because of PSA screening, studies estimate that roughly 50 others are diagnosed and treated unnecessarily, carrying permanent side effects for the rest of their lives. So do you throw the PSA test away entirely? No. You replace reflexive routine testing with something far more valuable: an informed, honest conversation. A real discussion between a physician and a patient about what the numbers actually mean, what the realistic probabilities look like, and, most importantly, what matters most to this particular person. Some men will hear the trade-offs and decide the remote chance of catching something dangerous outweighs the risks. That is a completely valid choice. But it must be a choice, not a default. For men already diagnosed with low-risk prostate cancer, active surveillance is a legitimate, evidence-backed strategy. It is not giving up. It is sophisticated medicine that monitors without destroying. And regardless of PSA levels, there are symptoms that must always be investigated. Difficulty urinating that develops or worsens over time, blood in the urine or semen, deep bone pain. These symptoms demand evaluation at any age. They are not to be dismissed, so there they are. The 5 tests, a full-body scan that manufactures anxiety from accidental findings. A brain MRI for normal age-related forgetfulness that labels healthy people as damaged. A routine cardiac stress test with a false positive rate that triggers dangerous cascades. A colonoscopy pushed past the age where its benefits outweigh its risks. And a PSA test that has caused an epidemic of unnecessary suffering in older men. Do you see the common thread running through all 5 of them? This is not an argument against medicine. This is an argument for better medicine, wiser medicine, medicine that understands that in the later decades of life, the goal is not simply to extend the number of days on the calendar. The goal is to protect the quality of every single one of those days, the independence, the mobility, the relationships, the joy. Real prevention is not a battery of tests hunting for shadows. Real prevention is a genuine alliance with a physician who knows you as a whole person. It is a thorough evaluation of how you are actually functioning in the world. It is a daily commitment to the habits, the food, the movement, the sleep, the connection, that genuinely determine how long and how well you live. What I want for you is not a life lived in fear of the next scan. What I want is for you to walk into any medical setting as an informed, empowered person who asks the right questions, who understands the why behind every test being ordered, who feels confident enough to look a doctor in the eye and say, "Do I actually need this at my age, given my specific situation?" That is not being a difficult patient. That is being your own best advocate. Health is not a clean report with no anomalies. Health is chasing your grandchildren around the yard. It's walking somewhere beautiful with someone you love. It's waking up in the morning with your mind sharp and your spirit ready. And sometimes, the single most courageous and medically sound decision you will ever make is saying no to a test you simply do not need. If this has made you think differently about your health or the health of someone you love, share it with them. It might be the most important thing you send them this year. Subscribe so you don't miss what comes next, and leave me a comment. I read them. Have you ever felt pressured into a medical test you weren't sure about? Tell me. I want to know. Take care of yourselves. And above all, take care of yourselves with wisdom.